My name is Dr. Benjamin Lampert, and I'm a physician specializing in the treatment of patients with chronic pain. For the last 30 years, I have offered spinal cord stimulation as a treatment option for those patients with chronic persistent pain. Chronic pain is pain that persists beyond the expected recovery period, or pain that accompanies a chronic health condition. Because this pain is not productive and is not the result of an ongoing injury, it is referred to as pathological and is therefore treated as a condition, not just as a symptom. Chronic pain prevents people from enjoying life. Spinal cord stimulation is a device that delivers a low voltage electrical current to the spinal cord to block the sensation of pain. Spinal cord stimulation is very commonly used for the management of pain. Tens of thousands of neurostimulators are implanted worldwide every year. Spinal cord stimulation is an FDA-approved medical treatment for chronic pain of the trunk, back, legs, or arms. Most of the spinal cord stimulation systems are powered by a rechargeable battery. Recharging is done in your home by applying an external charging belt over the implanted battery. It takes about 2 hours and must be done every few weeks depending on the amount of power required to suppress your pain. Eventually, a minor surgical procedure may be required to replace the power source if the time between recharges becomes impractical, usually after 9 to 15 years. Batteries that do not require recharging can also be used, but these need to be surgically replaced every 3 to 5 years. You might be a candidate for spinal cord stimulation if your pain is not from cancer and does not respond adequately to conservative treatment, like medications or therapy. Spinal cord stimulation might be considered if spinal surgery is not an option because of risk, or if surgery has a low chance of success. Before spinal cord stimulation is offered, you must undergo an evaluation to document that no major psychiatric disorders are present. This evaluation is required by most insurance carriers, including Medicare. If it is determined that you are a suitable candidate for spinal cord stimulation, the next step is to insert a temporary device on a trial basis. This is done to allow you to experience the therapy before committing to a surgical implantation of the spinal cord stimulator. During the spinal cord stimulator trial, 1 or 2 leads are temporarily placed using epidural needles under local anesthesia. These leads are then connected to an external battery. This trial stimulator is programmed with 1 or more stimulation programs customized to the specific areas of your pain. After 3 to 7 days of an outpatient trial period, the leads are painlessly removed in the clinic. The trial phase can be beneficial because it helps you to decide whether spinal cord stimulation effectively relieves your pain. It provides us with an assessment to determine which type of spinal cord stimulation technology works best for you. It enables us to evaluate different electrical settings. If the spinal cord stimulation trial provides adequate pain relief, then a permanent system may be implanted. Spinal cord stimulation is a reversible therapy, so treatment can be discontinued at any time by turning off the system or surgically removing it. Prior to the implant procedure, you may be sedated. A local anesthetic will be administered while the leads are placed. The leads are inserted into the epidural space using a needle placed through a small incision. The exact location of the leads depends on the location and type of your pain. The battery, or generator, is usually implanted in the back, but can be implanted in the abdomen, buttock region, or any other area that feels comfortable for you. Once the leads and generator are in place, the incision will be closed and a dressing applied. Before being released to go home that day, you will receive instructions on caring for the incision and how to regulate the spinal cord stimulator. Following implantation, lifting, bending, stretching, and twisting should be done carefully for 4 to 6 weeks to prevent movement or migration of the leads. Light exercise, such as walking, is helpful to build strength, prevent blood clots, and relieve pain. Return to work after 1 to 6 weeks, depending on the type of work, is expected. Although there may be some discomfort while the surgical incision heals, most patients say that they cannot feel the presence of the device under the skin after the healing takes place. Now I'd like to tell you a little bit about some of the conditions where spinal cord stimulation is effective. Arachnoiditis is a condition which is very painful, and it is caused by scarring and adhesions of the nerve roots in the spinal canal. When the spinal cord or nerve root is injured, persistent scarring, inflammation, or irritation can lead to chronic pain from this condition. It can cause a number of symptoms, including numbness, tingling, stinging, and burning pain in the lower back or legs. There is no cure for this condition, so the goal of treatment is to control pain and symptoms. Chronic regional pain syndrome, or CRPS, is a nerve disorder that results in intense burning pain in the injured extremity. It can spread to other parts of the body. It can occur after a minor injury, either to a nerve or to tissue in the infected area around a nerve. There is pain, extreme sensitivity, and changes in color, temperature, or moistness of the skin. The cause of CRPS is unknown, and there is no cure. Failed back surgery syndrome is a persistent or recurring pain after spinal surgery. There is often scar tissue on nerves which will not respond to repeated surgery but may respond to spinal cord stimulation. Neuropathic pain can occur with neuropathy. This condition may result from degeneration of the protective myelin covering of nerves. There are many conditions and diseases that cause this kind of nerve damage. Some people may experience numbness, tingling, and pricking sensation, sensitivity to touch, or muscle weakness. Others may experience more extreme symptoms such as burning pain, especially at night, muscle wasting, or paralysis. As with any surgical procedure, there are risks to spinal cord stimulation, including allergic reactions, bleeding, headache, infections, nerve damage, spinal fluid leakage, or worsened pain. Other risks include device malfunction, lead displacement or damage, which might require revision surgery. MRIs, ultrasound, defibrillators, electrocautery, diathermy, and cardiac pacemakers can damage or interfere with some types of spinal cord stimulators. There is good evidence that this form of electrical stimulation is beneficial for the treatment of pain. 60% of people receiving this treatment experience pain reduction for many years. If you would like more information regarding spinal cord stimulation, please contact your physician or check out some of the links below.
Hi, my name is Kim. I'm a patient of Dr. Lambert's. I've had a spinal cord stimulator for 10 years now. I have very bad low back pain and neuropathy down both legs and into my feet. Due to having the spinal cord stimulator, I've managed to keep working. I've been a waitress for about 30 years, and I still work 5 days a week. I also have a horse. I managed to take care of my horse. I had been through every other treatment there possibly was until we finally gave up and thought, let's try the stim and see what happens. So if you're even contemplating doing a trial, I said go for it. It completely changed my life. It actually gave me back my life. And so just go ahead and give it a try. Can't hurt. Thank you for listening. Take care. Bye-bye.